And regardless of which type of COPD they have, these patients are of course going to develop dyspnea. They can't get air in and or out. So that dyspnea is going to be worse with exertion. And then in an attempt to get more air in, you'll see them assume this tripod position where they're leaning forward, maybe over their bedside table. And that's just to try and help pull the diaphragm down to get more air in. If we listen to their lungs, we're going to hear wheezing as air travels through those constricted airways. And then because everything is exercise to these patients, including eating, we are going to see a lot of weight loss. And if we draw an ABG, of course, their oxygen is going to be low, right? It's going to have hypoxemia. But because these patients, remember, cannot get air out, they are going to retain CO2, which is a respiratory acid, and is going to create a chronic acidosis. So because this acidosis is chronic and they live in that acidotic state, their kidneys have had time to kick in and adjust and keep it compensated. So their CO2 will be high, but because it's a compensated respiratory acidosis, their pH will be normal. So for our first NCLEX quick check, take a second to pause and see if you can answer these 3 questions. All right, and if you're ready, what is the number 1 risk factor for COPD? That is going to be smoking, remember, because that damages the airways, causing chronic bronchitis, and the alveoli, causing emphysema. And what assessment findings are associated with emphysema? Remember, emphysema is the one with the pink puffers, so they are going to have that barrel chesting, and they're going to be using pursed-lipped breathing. And then what ABG findings would you expect in a client with COPD? Well, remember, they are going to have an acidosis, but it is going to be a compensated respiratory acidosis. So their CO2 will be high, but their pH will be normal.